Hi guys, it's Liz, your NP injector at DC Plastic Surgery Boutique. I want to chat a little bit more about filler today, go over FAQs, but before I get into that, I wanted to touch on our mission when it comes to aesthetic treatments, and that is subtle and natural. We want to keep you looking like you, but more refreshed and confident. So how do we achieve that? One of the things I do is a full face assessment for a more cohesive treatment. We don't want to just spot treat and chase lines and focus on one area. That's how things end up looking a little more unnatural. When you come in for a consultation, I take a series of pictures of your face at all angles so we can sit down and look at them together and talk about potential areas of opportunity where we may want to add a little bit more structure and support with facial fillers. So what is filler? It's a hyaluronic acid gel. We have hyaluronic acid naturally in our bodies. This is a synthetic form. It's a sugar molecule that attracts water, and we carry a line of facial fillers with different makeups, different thickness, so we can use it depending what we're trying to do in the face. If we're trying to add more structural support and mimic bone, like in the cheek or chin, we'd want to use one of our thicker products. We wouldn't want to use the same thing in lips. We'd want to use something much softer if we're adding some volume in the lips. So we have filler to address every area in the face. When should you schedule facial fillers? So you don't want to do this like right before a big event, like if you have an event coming up on the weekend. You want to do it 4 to 6 weeks in advance. Bruising and swelling can persist up to 2 weeks. This also allows time if we want to do a refinement. Slow and steady always wins the race. What should you avoid before and after injectables? So we want you to avoid, starting 2 weeks before, anti-inflammatories like Advil, aspirin, ibuprofen, Motrin, even some supplements like fish oil. We also want you to avoid dental procedures, even a cleaning, and vaccinations 2 weeks before and 2 weeks after. You want to avoid alcohol 24 hours beforehand. This all increases your risks of bruising. How long do facial fillers last? So this depends on which product we're using and where we're placing it. If we're putting it, using our thicker product in an area that doesn't have a lot of movement, like your cheeks, it's gonna last longer than a thinner product that we put somewhere with a lot of movement, like your lips. So all filler is temporary. It gradually melts away over time, although we are finding that it lasts longer in some people than the on-label reports. For cheek filler, for example, you can get about 1 to 2 years out of it. Lips, 6 months to a year. This varies person to person. Is filler painful? So this is a question I get a lot from patients, and it's an injection like any other. It's still a needle going into the skin. There is lidocaine in all of the filler products that we use, so it gets more comfortable as you go. From personal experience, I've had liquid rhinoplasty and filler placed in my nose, and I didn't use any topical numbing for it, and to me it was about a 2 to 3 out of 10 pain level. For lips, which are more sensitive and very vascular, we do apply a topical numbing cream because that area is the most painful.